Dr. St. Louis from the Laser Spine Institute in Tampa, Florida. I want to welcome both of you.
Okay.
And before we get started, first things first, how are you feeling?
I am feeling great.
Symptoms are better?
Amazingly better.
And explain to everyone what was causing Kate's pain.
Sure. Kate's pain was caused by a pinched nerve in her neck, and the pinched nerve caused pain to go from her neck and radiate down into her arm. And in her low back, she had some inflamed nerves that was causing rather severe back pain.
So let's talk about the laser surgery that you performed.
Sure. There's a picture of a cervical spine, which is your neck, and you can see a series of tubes being set down on top of the bone, which is the bone covering the spinal canal. And you can see insertion of the laser. The laser is used to remove the tissue around the spinal bone. We use a series of instruments which open the tissue, remove the tissue, and open the bone that that covered the spinal canal and that covers the pinched nerve. And subsequently, we remove the tissue and the bone spur that was pinching the nerve.
And will you show us the scar?
Sure, be glad to. As you can see, the incision's only about a ½ inch to an inch, and this is what differentiates us significantly from open spine surgery. We're able to do the surgery through a series of dilating tubes which allow us access without having to cut the muscle. Versus open surgery, you have to make a 3 to maybe 6-inch incision, and you have to actually tear some of the muscles out. With what we're doing, we separate the muscles when there's no requirement to actually tear the muscles to gain access to the problem that Kate had.
So what's recovery look like for Kate then?
It should be 1 to 2 weeks. At 1 to 2 weeks, she's pretty much returning to most of her activities.
Now, I do have to say, you know, the NIH says that laser discectomy is still being debated.
Sure.
Does insurance cover this?
Yes, insurance carriers cover this. What we do that separates us from many different centers is we actually remove the bone. To get to the spinal stenosis, we actually take special surgical instruments to actually remove the offending bone and bone spurs versus just working on the disc.
And we actually have Jody here who had this surgery done. And Jody, how are you feeling?
I'm great. It was 3 years ago that I had this surgery, and it's like it never happened. I live a completely pain-free life. I have no hardware in my neck like traditional surgery, and I get to be mom again, and I think that's the best part.
We're glad that you're feeling good, and Kate, we're glad you're feeling good as well. Dr. Simmons, thank you very much. Appreciate it.